Hello and welcome to the big story here on the BDTV Breakfast Show. This is where we have discussions shaping our nation and economy. My name is Elizabeth Musa, and today we are discussing the possible effect of Trump's move to close USAID, that's USAID, and how it will affect Nigeria. For context, President Donald Trump has unveiled plans to close the United States Agency for International Development, USAID, and merge it with the United States Department of State. Trump has made it clear he wants overseas spending to be closely aligned with his America First approach, and the international development sector is braced for a profound effect on humanitarian programs around the world. Trump described USAID's spending as totally unexplainable and should be closed down. In his words, USAID was set up in the early 1960s to administer humanitarian aid programs on behalf of the United States government. USAID's various humanitarian activities, such as the provision of food in countries where people are starving, including Nigeria, of course. Other programs run by the agency include the provision of medication to the world's poorest and installing clean water supplies. It also operates the world's gold standard famine detection system, which uses data analysis to try to predict where food shortages are emerging. Many people have argued that closing down USAID and stopping funding its activities would negatively impact poor countries across the world. Now, to help us understand all of this and more, we're joined by Business Day senior health reporter Temitayo Oladeyinde. She'll be speaking to us, giving us more insight on this topic. Welcome to the show.
Thank you.
Let me start by asking you a simple question. I mean, let's bring it local. Let's make it local. As Nigeria being a beneficiary of USAID's activities, and how is this going to impact us?
Nigeria has been a big, or what I would say, significant beneficiary of the efforts by the USAID since they started operating in Africa. Don't forget, we have the largest population in Africa. So, by the virtue of that, we are most impacted. Now, USAID has been helping mostly in the area of health in Nigeria. If you look at HIV/AIDS when it started and the fear and what we thought it was going to become, when HIV/AIDS started, we thought it was going to become something like COVID-19. There was this fear, but today you walk around, you sit with people with HIV/AIDS, and you're not even afraid. This is something that has been really, really done by the efforts of things what USAID does. Now they invest a lot in medications. They ensure, in Nigeria particularly, the USAID works through the US Centers for Disease Control. What they do is ensure that they facilitate drug provision for people living with HIV/AIDS. For instance, they also work in the area of malaria, sometimes tuberculosis, majorly infectious diseases and even non-infectious diseases sometimes. So this, for HIV in particular, they make provision for the drugs for these people almost free. These drugs are coming from partnerships with drug companies in America. They come here, people use it. There are a lot of people who are on those sort of drugs are able to sustain it because they can easily access it. The cost is not hindering them, and they're able to keep their health intact and go on and be productive to the society. So in the area of it, in fact, specifically, the USAID has spent, as of 2023, they had spent over $6 billion.
Oh, wow.
On health initiative in Nigeria alone. And not that our government has done nothing in these areas, but when you talk about every $1 spent on some healthcare initiatives in Nigeria, 95% of it is coming from places like USAID support.
And there have been conversations. I mean, recently the government has said that, they've tried to downplay the contributions of the USAID to the health sector, saying that it's only about 17% of the contributions. What do you have to say to this?
I think that is incorrect. And from what I even hear the government say, what I've heard from them is acknowledgement of the support that the USAID has given to Nigeria so far. And what this new wave, this Trump charade at the moment, what he's telling us, which they've also admitted, is that we need to hone our own challenge. We need to rise up. The Minister of Health, Professor Mohammed Ali Pate, when he was responding to this issue, was talking about how he was going to start rallying for domestic funding to actually come in, to be pumped into the first initiative that might be affected. One of them is HIV/AIDS. In fact, the Federal Executive Council last week, or more than a week ago, they approved 4.5 billion naira to assist with HIV. Yeah, so it's not 17%. No. In fact, if you look at the data from the National Agency for AIDS Control, according to them, 80% of HIV/AIDS funding, for instance, in Nigeria, is from external sources, from donations. Now, because these donations were coming, we saw our government spending on initiatives like HIV. It started declining. For instance, from 2005 to 2020, this AIDS started flooding in. Between that period, our own contribution, government spending, declined from 11% to 3.9% in 2020. That's how relaxed we were.
That's a very significant decline.
So I think what I've heard, what I've seen, even in their own books, is saying that is an acknowledgement of what they've done, and probably an acceptance that yes, it's time for us to begin to address our own challenges, put our money where our mouth is, appropriate more funds and implement them, not just allocations, because a lot of the monies we hear, despite the fact that the current allocation is not even up to the standard that we have signed to, that's 15% of our total budget should actually go to healthcare. This is something that we signed, we agreed to some in 2000, maybe 2000 or 2005. But today, that's not what we are doing. What we have done is to leave healthcare funding below 5% often. And that 5%, when you go to budget office, or the website of the budget office of the Federation, and you analyze it, not all is disbursed, not all is released. You find that about maybe 60, is it even up to 60% that is released, and some of them are even cash backed. So the money is not enough. It is not fully released. In the first place, it is not enough. It is not fully released. Most of the institutions, most of the things you want to do, but then you also hear that the government is doing some other initiatives that you kind of, when you weigh the importance of those initiatives to the healthcare initiatives that we should be pushing, should be stopping, you wonder where our priorities are. If you hear the amounts that are going to some constituency projects, you wonder whether we are actually serious about helping ourselves, because the point is that we have actually probably not, we've seen health as a back burner, whereas it should be a front burner.
It should be at the forefront.
And if today Trump is saying that America spends the most on healthcare and sees little effort to show for it, we should be uncomfortable with where we are, because healthcare, by several studies, has been related to productivity. How productive are we in Nigeria? The average productivity of in Nigeria is less than what you have seen probably in some developed countries when they were also developing in 1960. We are below average when it comes to productivity, and we have somehow kind of refuse to link our health care, the quality of health care that people can access, to the quality of productivity that they can actually push. When people are healthy and are okay, they can go on and live a productive life. They can contribute to the economy. If they have businesses, they thrive at it. But if a woman goes into a labor room and she's not sure that she's going to be coming out alive, maybe because of postpartum bleeding or labor bleeding, and there is little effort around to really support her during that period to not lose her life. These are things that should be on our mind. And but our spending, what we do is actually opposite. So maybe now that the Trump is beginning to say no to this funding, because it looks like a house cleaning to me. The US is cleaning its own house, and it's affecting us far here as in Nigeria. So if they finish, because it's just a freezing of the fund for like 90 days, that's about 3 months. So if at the end of 3 months, and we should be able to come up. We've seen some efforts from the government saying, okay, we'll push more. But for instance, 4.5 billion naira that was approved recently, we only cover 150,000 people who live with HIV/AIDS just for their treatment. We have about 1.9 million people who live with HIV. So how far can that go?
Such a paltry sum, and I just wanted, if you've already touched a little bit on it, but if you could just give us more insight on some of the benefits that were received. If you know, do these aids come directly to individuals, or do they go to agencies?
Okay, so like I said previously, the implementation of PEPFAR, which is the main body designed for this kind of fund in Nigeria, is done by the US CDC, US Centers for Disease Control. So they implement it, and they don't just facilitate availability of drugs. They do counseling. They work with hospitals. In fact, they work with about 1,500 health facilities in Nigeria, just to reach out to people who are suffering one disease or the other. They also do what we call human capital development in the health sector. For instance, last year I was at a forum where organized by the US CDC, and they were reading out they graduated some people you call epidemic champions. These are directors in the area of surveillance, surveillance of diseases, monitoring, tracking, disease control. So what they did then was to train these people with updated knowledge, technical know-how. When you have a disease that is building up, that is pouring out of Rwanda, for instance, like Marburg, or you have Ebola coming from DRC resurging, what do you do as a country? And if you notice, like for the past few years in Nigeria, in a way we can say we've been able to stop some of these diseases in their track. We did relatively well with COVID-19 because the projection was that people will be falling dead on the street. So, but what USAID has done is to, go around the entire country, states, people in the area of disease control, NCDC, people, those at the state level, they've brought them, they trained them on how to first detect these diseases, how to, sometimes they even partner when it comes to genomic sequencing, that's analyzing the nature of disease, because the disease might be coming from that place. Well, it probably is already existing here in Nigeria, you don't know. But so they empower them with the knowledge to be able to pick up these diseases, analyze them, align them with what is going on around the world, and take action. So that was it. So they also work in the area of diseases surveillance, not just drugs to people. So this is the effect of USAID is not far off at all. It is here with us, and we are feeling it. It is what we see daily. So we've had we've had Ebola, we've had COVID-19, and we've had some in fact, Lassa fever, these are all local infectious diseases. You have Lassa fever, diphtheria. They are really helping and supporting our own government agencies here to stop those diseases in their track.
I mean, it goes without saying, but what do you think will be the implications of the closure of the USAID by the Trump administration? Like I said, it goes without saying with everything you've said, but you might just want to add to that.
Well, maybe from an optimistic point of view, first of all, I'm not anticipating a total shutdown
Okay.
of the agency.
Okay.
Why? Because it's a one of the top AIDS advocates in Africa, said recently that this is a mutually beneficial arrangement.
Okay.
It's significant. The USAID works in they've saved lives in, that's about, according to the UNAIDS now, about 26 million lives have been saved by USAID since they started, and that's around 55 countries. And so when you talk about it's mutually beneficial, the drugs that are coming in, the people, the top echelons in this agency, the Americans, the people who are supplying us these drugs, most of these drugs are not produced in Nigeria or in the poor countries. So this is something that also benefits some of their own countries who get the contracts to produce these drugs for us. Shame on us that we can't do this all by ourselves. But then it's also something they've done. And if you look at it cost wise, what does it cost the US? You don't tell people where to spend their money, but I was listening to Bill Gates recently, and he said it's probably less than 1%. Something that does so much as saving less than 1%
Oh
of the
wow.
wealth of America. 1%. But because there seems to be a kind of a fuse around it now, so I don't see it totally closing. But what is the implication? There are two things. Two things can happen. Our government steps up in terms of funding healthcare and implementing these funds. So let the monies go to where they need to be. So that's one. The other thing that can happen is to have a situation where already it's happening. Out of pocket expenditure on health, as it is in Nigeria, is over 80%. So what I mean is, you are sick today, it's urgent, you need to see a doctor. If you go to the hospital now, you are spending out of, it's an emergency for advice, you are spending it out of your pocket. You don't, a lot of people in Nigeria do not have a social safety net that we call health insurance coverage. So you can't just fall sick. You're already paying for it. But what it means is that if you, for instance, have HIV/AIDS to also deal with, then you have to now fund these drugs by yourself as an individual, because you are not even sure what is coming from the government. So if the government steps up, there could be some form of subsidy on these drugs. There could be some form of subsidy on screening. There could be some of something in terms of supporting the healthcare, the human capital involved in providing these services for the people who need it, especially in poorer or rural communities. So that way you can still, it's some of a soft, is a kind of soft landing
Soft
for
landing,
people.
all right.
So they don't have to feel it that bad. But if our government is not ready to step up, then people have to pay for it, and it's going to be a lot of hardship for some people. Although there are studies showing that people are already expressing interest, there are studies showing that people are willing to pay. But how much are they willing to pay compared to the cost of some of these drugs? They are willing to pay as much as 5,000 naira for HIV drugs, but some HIV drugs are not 5,000 naira.
I don't even think it's a case of people are really into it. I think it's a case of if you when you're left with no choice, you would have to pay.
So you have to, then the next thing is you talk to your family members, everybody, you start disturbing everybody, and people have to rally to support you. Or the next thing is that the other implication which experts have cited is that these cases graduate into AIDS. Then you have a lot of people having AIDS because they cannot treat their HIV effectively with antiretroviral therapy. But one key thing is, the World Health Organization itself is facing challenges in terms of funding. They are struggling as well to gather funding from countries who have been supporting before. And you now find that it's also affecting the level or the depth of support that they can give to countries. Now with the withdrawal of USAID, there's a lot of confusion and palpitation everywhere. So last year, or as of 2023, when they released a report in malaria area, for instance, in the area of malaria, there was a positive trend that was noticed. A few countries are stepping up. Some countries have increased their funding for some health challenges. They've increased it to about 37%. Cabo Verde, an island that is now malaria free, is certified malaria free today. They spent on 100% of the funding for malaria, for instance, or for some other from health, is sponsored by the government of Cabo Verde. The funding is coming from the government. The government is rising up. The same with Senegal. Cabo Verde, Senegal, Cabo Verde, they are spending almost $10 per person at risk of malaria. How much does Nigeria spend on one person? That is, as of 2023, we spent $1. And that $1, 95% of that $1 came from donations. So the implications are really clear. It's either our government is ready, as they have said now, 4.5, like I said, 4.5 billion naira being released is a drop in the ocean. There is a lot more that needs to be more funding, which is why we are seeing the challenges. We are seeing lack of infrastructure, shortage of doctors don't want to stay, the challenge, the pay, remuneration, the incentives are not there. So we need to really make put our money where our mouth is. Let the government fund this thing, or the other way we say, okay, let's watch and let the citizens suffer. They will pay for it anyway, or some people will just die needless deaths, because the unit is already projecting since the aid stopped. Now that's towards the ending of January till now, we have had over 5,000 new infections with HIV globally. According to UNAIDS, that would have just been about 42 infections. So UNAIDS is projecting that if this situation is permanent, the aid stops permanently, what we'll see is more than 6 million deaths from HIV, for instance. Infections, we see over 8 million infections. According to the Africa Center for Disease Control, in Africa alone, we will see things worsen. We're going to see infections rise from 2 to 4 million. And when they say that, Nigeria is taking the larger share of it.
And speaking of $4.5 billion dollars, right?
Naira.
Being naira, that's a paltry sum. Being a little drop, imagine, I even thought it was dollars. Being just a paltry sum, and speaking of more funding as well, what other possible alternatives do you think that the government can adopt? Should we look for other possible foreign aids available, or do we just keep looking inwards?
We need to look inwards more, because what we have done so far is to keep looking. Don't forget, USAID has stopped. Not all other foreign aids. You still have Global Fund. You still have some Western countries supporting. So not everything has stopped, but what we have been saying, even in our reports over time, is that these resources are drying up. They are drying up, and they won't be there forever. And if you look at these countries, there's Trump. The Trump effect is the resurgence of protectionism. They are putting their people first. They are asking questions. These resources, have we fully attended to the people who need help? The homelessness in our country, have we finished addressing it, that we are funding? Looking out. So with the rise of protectionism, probably in the UK, in many European, this fund will continue to dwindle, and we'll be left staring at us our challenges. Our challenges will be staring at us. So nobody really, we should see it as a situation of no one is coming to help us. The government still has the resources to, if we implement what we have. Sometimes they say our problem is not spending. What are we spending on? Maybe the funding is not, if we are what we have allocated to healthcare, for instance, can we in a year say this amount we allocated it to healthcare, and that total fund goes to healthcare, and that total fund is implemented in all in the different health facilities that has been outlined for development, and we probably will begin to see effect. Not a situation where you have a significant amount of allocation not being released and you expect results. So we need to fund, and well, maybe to Nigerians need to raise up and know that times have changed. So if they were probably also spending on other, we need to begin to probably, look at how you can manage your health, probably lifestyle. If you don't have HIV now, you obviously know it is not the best time for you to have HIV. So you just be modest in
And
your
then Valentine is
lifestyle,
coming.
modify your lifestyle, make sure you are not in harm's way, you are not contracting any disease you don't need to contract. You moderate your health care, you eat right, you exercise, you do the things you can do as an individual to limit your chances of coming down with some diseases.
I mean, this is a good time for everyone to just take their health very seriously and just try to, in your words, stay out of harm's way, just to be on the safe side, because things are not, you might not get all of the assistance and all of the funding that you need. And with the way the economy is, set up right now, you might just need to really know how to channel your energy to the things that are very productive for your health. But thank you so much, Temitai, for shedding more light on this story for us this morning. It was truly important and very insightful. Thank you. And that's how we bring it to a wrap here on The Big Story. My name is Elizabeth Musa. Just stay with us for more.